So my name's Millie Dickens, Mildred, legally Millie, for casual. And I've been seeing Dr. Haynes since January 2020. I came for a second opinion on my right knee because it was locking all the time. And I was afraid I was going to lose the ability to drive. And I knew I needed a knee replacement, but I was the caregiver for my 102-year-old dad, so it wasn't a good time to have a knee replacement. So I just wanted to see if anybody would do something that could possibly help me buy a little time. That if you have severe arthritis, nothing else is going to fix the arthritis. You need to get it out. But if you can't have surgery, then you feel like you're just lost. What are you supposed to do? Who's going to take care of my dad? Um, I needed somebody to understand that this just wasn't a surgery I could go through, but I also needed to be able to drive. Was there anything that could help? So I felt listened to when I came here. My brother's a patient of Dr. Haynes, highly recommended him, couldn't say enough good things about him, and that's how I made the call here. Just trying to find somebody that would listen to me and see if there was any possibility other than telling me I needed a knee replacement, which I knew I needed. I lived in Chesapeake, so had the first knee replacement in Norfolk, and I was just told you need a knee replacement. So I knew I couldn't have it then and take care of my dad. And nobody was willing to help me except do the knee replacement. So I came here to see if there was any possibility that something could be done, because it was happening when I was driving. And that was really scary when your knee locks and you can't move it, and it's your right leg, and that's your driving leg. So I almost cried. I was so relieved when Dr. Haynes said, yeah, let's do an MRI. If you have what I think you have by your symptoms and your description, then I can help you. And the MRI did show what he thought it did, and had arthroscopic surgery the next month. And slowly, the pain in the knee got worse and worse. So I came in and talked to him about starting the process for the knee replacement. And he's just so engaging, and so it just takes complex medical information and gives it to you in a simple, easy way to understand. He's very patient and willing to listen, which is a big one in my book. Very respectful, and answers all my questions. And all the staff were so nice and explained everything. And I talked to him about PT before surgery, which he said was a great idea because I was almost 76 when I had the knee replacement. So, your legs just aren't as strong when you're older. So I went to PT for the month before I came to have the surgery, which helped a lot. And then I think the next things that made it so great was outpatient surgery. So I had the surgery and went home, so I could walk as much as I wanted while the knee block was keeping the pain from me feeling the pain. And then the bicycle that was part of my in-home PT was amazing. All these are things I didn't have the first time. I didn't have outpatient. I didn't have the bicycle. And that is a different kind of movement. When you're doing a home therapy, there's limits to what you can do. But that was great in those first couple of weeks to have that before I started outpatient. And then the awesome PT that I got, I came from my PT outpatient here, and this is the best. I've had a lot of PT over the years for back, hips, knees, and this is probably the best place I've ever been. I've been to good ones, but I've never been to what I call excellent. So it helped me recover from my surgery really quickly. So it was very easy, much different than my first time around. So, and they're so great here because if anything bothers me, I tell them, they adjust the exercise, or we do something else, or they just adjust it so that it doesn't hurt. And if something's not working, we talk about it, they change, and then we go in another direction. So that they're willing to listen, and they're just really helpful and respectful. Well, I'm just so grateful that I found Dr. Haynes. That my brother knew somebody, because I didn't know anybody on the peninsula, because I never lived over here, so I didn't know anybody. I just knew I needed to see somebody else, and I didn't know if I would continue. I really just came to get a second opinion to see if anything could help. But I felt so comfortable after my first visit. I knew that this is where I would stay for the rest of my work on my knee. He's just, you can tell that he cares about his patients and how their recovery goes, and making them feel comfortable through the whole process, and everybody else in his staff too. You know, with the injections, with everything else that you might need along the way. I don't ever feel like they're too busy to answer my questions, even if they seem a little silly. And my goal was always to be able to walk 5 miles again. So this fall I have walked 5 miles many times. So now that I have both knees, I feel like I'm actually done. I'm back to life.